Okay, so I'm going to be doing an eye examination video here of my boy George here. One of the biggest things that we're going to do right away is just doing a general palpation of our patient. So I'm just going to have the ophthalmoscope just chilling right here. So the very first thing I'm going to do is just look for any, just palpate the areas and just kind of feel any type of deformities, any type of crepitus, any type of false movement, any type of temperature change, normal things you would feel with a palpation. And just trying to get an idea, tissue density, things like that. So I'm just gonna go ahead and feel the frontal bones. Looks like nothing's there. I'm gonna go down this periocular region. Nothing here. I'm gonna go ahead and feel the orbital rim, the orbital bones right here. No crepitus, it's a good sign that we don't have a trapdoor injury. Another thing I'm gonna look for right here, just going right here on the nose, just feeling the nose out, feeling the nasal cartilage. And then we're going to go ahead and feel the zygomatic bones, which are the cheekbones. Nothing there. Another thing we're going to do is feel the temporal mandibular joint. And what I want you to do, George, is just open up your mouth and then go back down. So one of the biggest things you want to do with the temporal mandibular joint is just look for any type of movement that is kind of unaligned. So if this side moves up a little higher than the other side, and then we can have some TMJ, some temporal mandibular joint dysfunction. Ooh. And then another thing we're going to do is just go for the maxilla here. Maxilla seems fine. Then we're going to have George lift up a little bit, feel under his chin. And then we're going to check his hyoid bone, which is right here. We're just going to move it, make sure it's fine. A little clicking sound, it seems normal. And then another thing we're going to do is just check his teeth. I don't have any gloves on. I don't want to reach down his throat. So what we're going to do is just have him open up his mouth. And I'm going to turn this on. And then I'm just going to look for any type of fractures, anything like that. Just up and down his teeth. Looks like he's fine. So that's the biggest things we want to look for palpations. The next thing we're going to do is do a general observation, inspection of things. So I'm just going to go ahead and look into his eye with the light, just to have a closer look at the structures. And I'm just going to go ahead and open up your eye, as you can. Open this one up. Just look at the globe, look at the sclera, looking at the cornea, looking at the pupil, and then getting a better view on this side of the cornea. And just looking for any type of visual deformities, any type of discoloration, any type of swelling, any type of bleeding, anything like that you can typically see in an eye that's injured, or has any type of pathology. We'll just do the same thing on the other side. We're going to be looking at the sclera, the iris, cornea, pupil, just looking around the region, looking at the globe, making sure it's white, making sure it's fine. And I mean, if we wanted to, we can just get a deeper look at things, maybe go down here, go up, make sure nothing's wrong. Same thing on this side. Just looking up. It looks like no visual deformities, no swelling, no discoloration, nothing crazy. So, next thing we're going to do is we're going to have George here. We're going to do a pupillary eye test. And we're going to test both eyes here. So what we're going to do is I'm just going to have the light here, and I'm just going to shine it into his eye, and we're going to look for a constriction of the pupil on both sides. So let's go ahead and do this. Constriction there. All right, good. On the other side. All right, so both are equal, both are fine, no delayed response, nothing crazy. So gives us a good indication that his pupillary refill, pupillary reaction is fine. Next thing we're going to do is a Snellen eye chart test. So what we typically do for a Snellen eye chart test is we're going to cover one eye, and we're going to get the visual, try to get a visual reading on both his eyes. So we're going to cover up one eye, and then George is going to look straight ahead over here, and then he's going to tell me what he can, what are the most, how far down he can go before he can't read a slide. And whatever's the farthest he can go down to, that will be his vision. So for instance, let's say George got down to the, let's just say George could only do the first one, the E, which was what I would be able to do. For example, so if he went down to the E, and E would be 20 out of 100, 20 vision out of 100, which basically means what he sees at 20 feet, most people can see at 100 feet, meaning his vision's a lot worse than most people. If he had regular vision, which is 20/20, it would be normal. So that'd be normal. So we're just going to pretend we're going to do the test. Just pretend. So we're just going to cover up an eye, and then obviously George would go down and tell me what he can see. Obviously, we don't have a Snellen eye chart, so he would just go down, tell me what he sees. If it went down to like 20/50 or 20/20, then I would explain to him what his results mean. But we would just do the same for the other side. Brittany, you did not see that. I'm taking very good care of these. And we're just gonna do the same thing on the other side. And just look over there. And we do that for the Snellen eye chart. Ooh. All right. So another thing that we gotta do is just check the muscles of the eye. And this can give us a good indicator for pathologies as well. I guess I don't have a pin, but I'll just use the end of the ophthalmoscope. Well, I don't want to use that. I'll just use my finger. I don't have a pen. I had it on me earlier, but I don't know where it's at. So what we're gonna do is, George, you're gonna be looking at my finger, and I'm just gonna put it in multiple directions. You're just gonna track it, okay? All right, so let's go. And I need you to do this without moving your head. Pure eye movement. Ready, you go. Alright, so we went all directions that we wanted to go. Seems like he tracked it pretty well. I would say his eyes are within normal limits. Another thing we're going to do here is we're going to find our three visions here, and I'm going to look into George's eye. And my visions for checking into his eye for nearsightedness would be a 0, which would be about right here to find the clearest. So I'm not going to need my glasses for this one actually, because of the lens on here is really, really nice. Don't have to worry about it. And I'm just going to be looking into this lens, and about right here, a 0 is fine. I already did my numbers. A -2 for far vision is good for me, and a 2 for 3 inches away is good for me. So those were mine. So all I'm going to do is I'm going to do a retinal examination of George's eye here. And George, all I'm going to have you do is just look straight ahead, and try not to look at me. And what I'm going to do is I'm going to get the ophthalmoscope. I'm just going to put it, and I'm just going to go directly straight to him, and then I'm going to look inside the retinal region, and then I'm just going to tell you what I'm looking for. So I'm going to go straight to it. George, don't look at me. Look straight over there. And I'm going to look on it. And then I'm going to be looking for the fovea, which is a little black depression inside the eye. That's where most visual activity happens. If you have any type of like deformities in that area, any type of irritation in that area, it can give you a good indication for like double vision, things like that. Another thing we're going to be looking for is the optic nerves, how they connect, and the optic disc in there. So it's just going to be like a little bundle of veins that kind of stick together. So that's the second thing we're going to be looking for. So I'm gonna go again. George, keep looking straight ahead, and I'm gonna go straight on it. And I'm just gonna look directly in there. Boom. Looks fine. Looks like nothing's crazy is going on there. One thing I forgot to mention earlier about the Snellen eye chart is that you need to be 20 feet away. So I'm just bringing that up now. But anyways, with this, it looks like he's fine. His optic nerves, his optic discs are within place. His fovea seems fine in the retinal region of his eye. So I would say that his eye is fine and within normal limits, I guess you can say. So